Need a search engine optimization SEO services? Then get in touch with our professional and friendly team to learn more about our range of custom and tailored services designed to suit your exact needs. Every one of our professionals have acquired years of experience, which ensures you get the very best. Our experienced staff is waiting to hear from you and to answer any specific questions that you may have on how we can meet your needs. Just ask for a consultation and let us prove our commitment to you as we promise to maintain the highest level of quality and commitment. Your satisfaction is our prime concern. So please, don't hesitate to get in contact with us and let us show you all the great options we have.
Loud and proud, outrage porn free. Okay. And we are the Coalition, loud and proud, outrage porn free, civilly disobedient media, broadcasting live on the Coalition Radio Network. Facebook.com/the Coalition Radio, on the Mighty Mighty Twitter at Coalition_radio. And of course, the mothership, which is now CoalitionRadioNetwork.com, as we move all of our programming over to our new site. You'll be able to watch a lot of our shows in replay throughout the day and throughout the evening as we morph into more of an accumulation of individual efforts as opposed to a single Coalition Radio show. So I hope you'll take a moment to like us and share us and give an opportunity for a distinct group of voices to be heard, both in Rhode Island and nationally. Joining me on the line and through the miracle of IP address and webcam is someone who is no stranger to the show. He's been with us for actually a couple of years. He was a candidate for governor here in the state of Rhode Island. And I'll say it because he's too polite. It's clear that certain people should have listened to him. Yikes. Dr. Luis Daniel Munoz, welcome back to the show tonight. It's been a long day for you, but we're taping tonight, and we want to give you an opportunity to kind of reflect on the latest developments here during the COVID crisis. What are your thoughts tonight? Dr. Munoz, I think you're muted.
Oh, thanks, Pat, for letting me know. So I was actually trying to help. I was trying to help control sound, and then I just forgot to take the mute button off. So what I was saying, Pat, is I wish I could tell something.
Tell you what, why don't we start this from scratch? Okay, let me just message Joel.
Sure.
Because I missed, what you've got to say is very important to me. I'm one of those hosts who actually listens to, listens to and is interested and intrigued by his guest.
So we're ready to go?
In a minute, hang on. Why don't you cut out and rejoin? Okay. Or
So the link has been shared, right? And so it's already, there's watch parties going on Facebook and stuff.
All right. So let's just go from there. And we apologize, folks, for the technical confusion. So, all right. So let's start from scratch. So again, if you could give us your reflections, unfortunately, folks, if you're listening, I apologize. It's late at night and I couldn't hear a word he said. So just give me an overview so I understand where you're coming from as far as tonight goes.
Yeah. So again, I mean, last week, about a week and a half ago, I started to see some progress. It seemed, that the administration was really listening. So let's describe what had transpired. The DOH had made on several occasions data errors. We didn't know if things were improving or not. The reality is that they have not been improving. The amount of positive cases is quote unquote steady, but it's really a lack of access to testing that's keeping it stable. Additionally, we started to see that we had data points where discharges had actually been deaths. And right around that time, some positives that came out of that same week where there was clearly some significant number of negatives was that the testing sites started to show up in places like Pawtucket, Central Falls, Providence. And it seemed reassuring, but the more you dig in, then we started to hear reports that one of the new testing sites in Providence was only conducting 10 tests a day. And then sure enough, there was some amount of media regarding these new testing sites. And once the media was out there and the announcements were made, I think they thought that was enough. And suddenly we see a contraction, kind of away from focusing on investment in community health infrastructure and instead focusing on this idea of reopening the economy without properly preparing not only healthcare from a community health level, but also not preparing our micro businesses and small businesses to really redesign themselves in a way that can help, mitigate the spread of this disease, but also protect their businesses, seeing that those businesses will be shut down by the DOH if they turn out to be epicenters of resurgences of COVID-19 in the future. So we're heading towards this reopening of the economy that threatens to trample over our vulnerable communities, but also it's not helping the micro businesses that do not have adequate designs today to really protect their employees or consumers. And I know that there are a lot of people out there and they can stand on the sidelines and they can say, I don't live in communities of color, I don't live in urban core communities, and they can feel, somehow disconnected from the reality of what's going on in those hotspots. But here's what they should know. They should know that any investments made in community health in the urban core, any infrastructure investments and developments made in the urban core in the places that are hotspots today, like Central Falls, like Pawtucket, like Providence, the benefit of making those investments is that foundation, that infrastructure serves as a model for other places, other cities, other towns, and even those that fall within the scope of rural communities. And so again, if we protect our most vulnerable, if we set them up for success, then everyone in Rhode Island is going to benefit. And that goes for setting up our micro businesses for success as well. So that's where we are today, Pat. I'm a little concerned. We're pushing towards a reopening and we're just not prepared.
Anyone who took the time over the last few months, as we became more aware of the growing tragedies within our urban core, to actually drive up and down Broad Street, and maybe you're from EG or myself like Cumberland. I spent a lot of time over the last few years in the southwest and north end of the city. Always kind of feel like Providence is my turf, but if you hadn't and you've done it recently, you've grown to understand that there is a quilt-like fabric of community in the urban core. On a given block, literally dozens of small businesses of every type imaginable, of every professional level imaginable, of every type of retail imaginable. And they're compressed into these areas. A lot of these businesses are startups. A lot of these businesses represent literally the American dream for folks who have looked for a hand up, but not a hand out. And so often is the case with newly arrived communities in this country, their first step up the ladder towards personal prosperity for themselves, their family, and their community is by owning a small business. So what you're telling me is that while we certainly have the CVSs of the world on board, and I'm not, no ill will towards them for this conversation, we certainly have the Twin Rivers of the world on board. All the really, really big companies, they've got the equipment, they've got the training, they've got folks who can train. They've got folks who have the resources to do what it needs to do to adapt physically to this continuing, pervasive threat. But am I to assume that literally none of this training, none of these resources, none of what's necessary to keep these emerging critical new businesses in the urban core have been afforded any of these facilities, these training, these efforts, these issues?
Right. I mean, what it really comes down, I've been listening not only to the press conferences, but there's been a post-press conference kind of forum or opportunity given to independent media outlets. And as you may have seen, Bill Bartholomew has been sharing that with the public, and what you're hearing when the governor and the DOH and Commerce Rhode Island and the director of administration, when they're answering questions to the media behind the scene, not on TV, you're really starting to get a sense of who's driving the car, who's managing, what department is really controlling this push towards reopening the economy. And it's Commerce Rhode Island. And given any other time in history where there's not a pandemic, that makes complete sense. But in a time when there's a complete culture shift, not only in how people interact, how communities interact, but how businesses interact with their customers, the path towards reopening has to be driven by the Department of Health. It has to be driven by a department that considers public health measures, how to implement them, and how to document and report them as well. So here are some things that micro businesses, the small bodega, the small restaurant, have to suddenly do, right? They suddenly have to not only develop infrastructure like plexiglass separators between those that are in the cashier and the customer, but they also have to consider healthcare supplies, so sanitizer, personal protective equipment. So let's say that stuff is simple. I don't necessarily think it is simple, but let's assume that the Department of Health and Commerce Rhode Island can, as the governor says, give everyone a few supplies to start off. The secondary issue is that now they have to collect temperature of their employees. So they have to take temperatures. They have to have good equipment, good thermometers, right? They also have to know how to use that equipment. They probably have to make sure that they're doing it with enough frequency for the data to matter. And then what do they do with the information? Now we get into a reporting challenge. Now they're reporting their employees or documenting it somewhere that their employee might be sick. Now their employee that was considered sick, even if it's COVID-19, has to now go home and likely not get paid if they exceed the certain amount of sick days they've had. So we walk down this path, and what you find is that these small businesses are going to be subject to not only HIPAA and healthcare related regulations, right, because of the activities that they're conducting, but they're also now possibly confronting liability, an additional layer of liability when they're essentially sending their employees home without confirming whether they have COVID-19 or a fever as a result of a common cold. And so again, even when we're looking at micro businesses and opening up the economy, we have to prepare those businesses both on two fronts, and not only in understanding how to redesign the business, how to interact with their employees and customers, but also we need a level of shared accountability. The DOH needs to take accountability for all of the healthcare related activities that micro businesses are doing so that they're not at risk for lawsuits, as much as, the need for them to protect the public. But if the Department of Health is not driving this car towards opening up the economy, and it's Commerce Rhode Island, then they're going to neglect those micro entities. And what I can say is history has shown the first ones that they will neglect will be the micro businesses that are in the urban core.
So the question begs, the state has been allocated anywhere from $1 billion to $1.5 billion in special money. The congressional delegation is rife with attaboys in talking about just what they've done for the city. What, for all this effort and all this money and all these people and all this time and all this planning and all this expertise, what's actually being done on the ground right now? Besides press conferences, that is.
Community organizations. Honestly, community organizations. People are on the ground working for free because they don't want people in their community to die.
Well, I should jump in for a second. When I meant that question is what's actually happening at the state level. I'm aware of your efforts, and I'm aware of a number of efforts that are geared towards folks in the community helping other folks within the community. But for all these efforts, all this vast conversation, what is the state actually engaging in on a day-to-day basis in terms of actual activity? Go ahead, buddy.
Right. So if the federal delegation, U.S. senators pull in $7.25 million for community health infrastructure across several municipalities, as if $7.25 million in a pandemic is enough to create sustainable infrastructure. So just today, United Way, also had a forum, and some of our federal delegates were there. And, when you hear them talk, they acknowledge that they're aware of healthcare inequities, but the pathways that they wish to take to acquire funds, it's the same snail's pace path that they've taken in the past. And we need urgency. There is an urgency to take radical steps to get resources today. So in terms of federal delegation at that level, nothing has changed. The level of urgency really has not changed. The pace of funds coming to the state, it's no faster than it was in the past. In terms of the state, there was a joint task force that's been created, and some of the challenges that Representative Filippi has pointed out regarding how whether that task force has been developed and adheres to the rules, right, of the General Assembly. And so the fact is, you have this task force that is tasked with allocating resources to communities during this crisis. And Representative Anastasia Williams has recently pointed out that on the line items that detail where the money is going, you have a lot of line items that are categorized as other. So we really don't know where the money that this task force is supposed to allocate towards areas to respond appropriately to this crisis is actually going to go. And then you have this promise of $1.2 billion, right, coming to the state and then being distributed primarily by one person, by the governor, a governor that is neglecting vulnerable communities, a governor that is pushing us towards reopening the economy without having made sufficient investment in community health infrastructure. And that is the single political leader in the state of Rhode Island that will allocate $1.2 billion. And the question is, to where? Where is the money going to go?
Right. Meanwhile, the legislature is talking about convening. They're talking about potentially having a conversation. They're not inclusive as in the entire representative body. In fact, it would appear that the sort of a replay of the Night of Long Knives, that there's a group of them just ready to divvy up the money, again, with no accountability, no conversation, no discussion, no needs analysis. Wow. So I'm not going to put you on the spot for a prediction, but I'm going to ask you from a professional level, given the ill preparedness, and by the way, no one looks forward more to reopening the state for business. And by the way, the very notion that the state feels that they're in any sort of moral authority to decide when to open or reopen is ridiculous to me. That that they've taken control of this process after a record of such outright failure is ridiculous to me. But what potentially can happen if you've got cities like Pawtucket, Providence, West Warwick, Woonsocket, all reopening in these crowded conditions with nothing more than a lecture from the governor?
What can happen?
Yeah. What can go wrong?
Yeah. So, well, look, the transmission rate for COVID-19, we already know that it's high. 2 to 3 people can be infected on average. For every one infected person, that person can infect 2 to 3 others. We also know that 25%, so 1 out of every 4 persons, are asymptomatic, but they can still infect others. We know that densely populated communities, communities that are dependent on public transportation, like we saw in New York City, really can serve as hubs for massive resurgences. We also know that given that it's the summer, we're walking into the summer at least, it's the spring, but that there's going to just be a lot of outdoor activities, a lot of incidences or situations where people will be closer to one another, where there'll be crowded areas. It's just it's a hotbed for a hotspot, right?
Right.
And that's really my concern.
So we, after losing months of economic activity, after crippling an entire industry in terms of our hospitality industry, which is so important for employment at so many different levels in the economic ladder, if you will. Despite all of this, it's my contention that we are sort of lapsing into this reopening ill-prepared for anything of the sort. Am I wrong? Am I far off? Am I exaggerating?
No, we aren't ready. And here's the thing. Again, anyone that feels that the economy should reopen and that it should have never been closed, whatever the thoughts are, what I would say is that Commerce, Rhode Island should have had boots on the ground weeks ago. In one way, shape, or form, Commerce, Rhode Island and all of the PR people that work for Commerce, Rhode Island should have been, with instruction by the DOH, bringing or Zooming with business leaders on an individual basis, because Rhode Island's small enough to do that, or at least on an industry-specific basis, and talking about how do you redesign your business? How do you redesign the way humans traffic through your business? How do you use 2 exits to ensure that you pretty much have a one-way pass from the entrance exit to the from the entrance to the exit? How do you do these things? And those conversations would have, more adequately prepared us to reopen the economy, and at least from a business front, ensure that the businesses would not serve as epicenters for spread. There's a public sector aspect to this, right? Like, the governor just mentioned that kind of a loose executive order that masks should be worn in public, given that there were exceptions with that. But again, we're taking measures today that ultimately aren't, unfortunately, going to make that much of a difference, given that we didn't properly contain and mitigate the spread early on. So that goes to another point, Pat, that I didn't emphasize enough when I opened the conversation, which is track and trace. The governor has touted that she mentioned to Salesforce that it would be a good idea for track and trace to be used. Salesforce was already working with Massachusetts. An entire tech infrastructure was already built out in Massachusetts for track and trace. Over 1,000 employees tracking and tracing. And not only are the employees that are tracking and tracing working within that infrastructure, Massachusetts has a unique model where local boards of health are set up for different towns and cities. Some of the local boards of health will cover multiple towns, but in general, you have small DOHs, small departments of health that all work under the Department of Public Health in Massachusetts. So when you talk about mobilizing information, tracking and tracing, and then having a point of contact for residents to go to when they need to be triaged for care coordination, Massachusetts has the infrastructure to be successful. We don't. And this is where accountability needs to be spread, not only the accountability that the governor should have in the indecisiveness and slow response that the administration has had to COVID-19, but also our mayors. I mean, mayors, city council people, there were a few out there that were sounding the alarm, that were trying to make noise to make the public aware, but there were many others representatives, again, mayors, city council persons that sat back in the shadows instead of thinking innovatively about things like local boards of health. How do we equip our town or cities with, kind of a level of a department that can manage health and be autonomous, independent from the DOH in the event that the DOH can't handle it. And what we're finding now with these errors in data sets that the DOH has is in fact that the Department of Health was not equipped to manage data sets and to really narrow in on important local information. And so cities like Central Falls and Pawtucket are concerned now because they see positive cases on the rise, but they don't have the information to know how many people that live in those cities have actually been tested. And that information hasn't been made available to them. So here we run into the biggest challenge of all. Now the mayors get it, but we're so far into this crisis, Pat, the question is, could we even mobilize, units, local boards of health that could properly address the track and trace needs and the data needs of those cities? And if we can't, we're suddenly, and continue to be completely reliant on an administration that is just not well equipped.
Has the administration at all been faced with any of these questions? And I ask that only because we all know the dog and pony show, the puppet shows that occur every day at 1 o'clock, a stilted, well-rehearsed, controlled environment. Folks who've clearly taken lessons from handlers on how to stare sternly into the camera, to be in some type of phalanx behind her so that it projects power and authority and control. That's all great, but is there any public recognition of the concerns that clearly a significant number of the communities within cities and towns across Rhode Island are grotesquely unprepared to reopen for business?
So I'll start with saying a heavy hand isn't a wise hand, and this administration seems to continue to try to play the heavy hand on those press conferences. And in terms of concerns, is there general public concern? Yes, I think there is public concern. I think it's growing. We're starting to see resistance in the ranks of the Democratic Party, just to be very specific, pointed about that. So the mayor of Providence seems to be in direct confrontation with the governor, and their orders don't seem to align. Now, that was going on from the beginning. There was not consistency between what Providence was doing necessarily in the state, but now they're more vocal about that. And that's, I think, partly because the mayor's feeling the pressure of the communities of color, in Providence that are suddenly, really, I would say, coming together to speak out. They were all speaking out, but there's been more of a unification recently in a call to action for things like outreach materials, translation interpretation services, just mediums that can get the information to families that really don't even know what's going on 2 months into the crisis.
Wow. So hundreds of Rhode Islanders have died. Thousands have suffered. Businesses destroyed. A urban core that is ill-prepared for the type of daily conduct, if you will, that occurs in the normal course of a business day. Have we approached anywhere near what I'll call a synergistic level of testing? As at any one point in time, there have been more than a double-digit percentage of folks who have been tested within a finite period of time? Because my concern has been all along is that I was tested, let's just say hypothetically, I was tested a month ago. There's this canard out there that somehow that is cumulative and I don't need to ever be tested again because clearly I've existed in a bubble in the last month, which is not true. So what would you estimate, I don't even know if this number is available, that the highest level of concurrent testing within and I don't even know what to establish as a finite period of time. Is it 3 days, 5 days, 7 days? What do you think the highest percentage of Rhode Islanders is?
I think to get to, if we're looking at South Korea, countries that have been very successful because of the testing, the amount of testing they've done, the most simplified way of thinking about it is, 3 tests per person. At a minimum, 3 tests per person. So you know that there's a 30% false negative rate, meaning that 30% of the time with the test that requires a swab through the nose, those tests, 30% of the time, you'll get a case where you're told that it's a negative result, but you actually do in fact have COVID-19. All right. So you can run 2 tests in the beginning just to try to capture that false negative. In other words, hopefully the second test you'll end up seeing that it's positive, so it catches you, so you don't go back home thinking you're negative. But also in South Korea, they were actually running 2 tests even after the virus cleared, just to confirm that you didn't have the virus, so that it was absolute that there was a point when you had it and there was no, the chances of a false negative were lower because you had 2 tests early on, and then they ran a couple of tests after to make sure the virus was cleared. So that's 4, but at a minimum, we're not even doing 2, right? So my point is that really understanding the error rate in these tests and understanding that we do need people to know whether they are cleared of the virus so that they can go about their daily lives. We need to be thinking of the scale here in Rhode Island as 3 tests per person. And so right now, the governor's aim is to have 3,000 tests, because that's a 1 test per 1 person goal. And what I'm saying is that is not enough testing, period, in terms of the amount of people in our population that need to be tested. But if we wanted to actually compare ourselves to South Korea and to kind of meet that standard, we would have to multiply whatever number we arrive at by about 3, just to ensure that we're giving people as much of a chance as, reducing the likelihood that they would have a false negative for the test. So again, I mean, let me summarize the numbers. That means that if the governor is saying 3,000 today, it should be 9,000. And that if we're saying that we want people to get tested, especially in communities that are hotspots, that have barriers to access today, that number needs to be far greater than 9,000.
How many Rhode Islanders have been tested overall? Do they have what's the absolute handle on that?
I don't have the most recent number. The DOH, that might, that is, those numbers are posted. So the total amount of test number can be found on the DOH site, just because I don't want to misquote what today's number is.
Right.
Okay.
But is it approaching, say, 20 to 30% of all Rhode Islanders?
No.
No. So 2 months into this, we have yet to even reach a point where, just for the sake of argument, 10, 20, 30%, 40% of Rhode Islanders have been tested. So we don't really have any idea whatsoever with the scope of what we're dealing with here, do we?
Well, no. And so for those that are out there saying herd immunity, like, let's run Sweden's model, let's be clear. Sweden may not be panicking about the fact that their people are dying, but their people are starting to die because they chose to have very loose policies around their COVID response. I mean, I can't say that they weren't recommending social distancing, but they really had no means of enforcing it, and it seems like no will to enforce it. And so here we are with this idea of herd immunity. So in the event that a vaccine doesn't come for a year or 2 years, well, just let the virus run its course, independent of the fact that it may kill, thousands of people in Rhode Island. So let it run its course. Here's the problem with that. The problem is that in the best case scenario, if the transmission of a virus is low, in other words, if it's not infecting 3-4 people, if one person that's infected doesn't infect 3 or 4 people, if it's just one person they're infecting, if the transmission is low, and in that scenario, if you get 60% of the population in an ideal scenario to have contracted COVID-19 and survived, then you might be able to get to a stage where you can say, oh, we have herd immunity. But even to prove that, you would have to have expanded your testing to know without a doubt to know that everybody of that 60% in fact had COVID-19. So that requires that antibody test, which really has a 50% error rate for false positives, meaning that 50% of the time it'll say you're positive, but you're not for the antibody. So you would have to have that test, cover that 60% of the population when we can't even do that with the nasal swabs. So that's the ideal scenario. That's the only way that we can prove herd immunity. And for doing that, for proving it, for being loose in our policies, leading to thousands of deaths. So, and people keep saying herd immunity, but let's talk about the reality. The transmission rate for this virus is greater than one person is infecting 2 to 3 other people. And we don't know if the virus is going to mutate, get stronger, and whether the transmission rate may go from 1 to 4 people, but it's still high today. And so with that high transmission rate, the premise that 60% is enough is no longer true. We suddenly need more of the population to have contracted COVID-19 and to acquire immunity and to prove that they have the antibodies. And so think about that. By getting more infected, by having to prove it, by allowing more to be infected, more people die. So it doesn't make sense for us to sit back and say that we should follow this path of like evolution and just allow everyone to get infected and assume that nature should take its course and do nothing to try to prevent it. That's from a moral perspective. I mean, that's not right. Ethically, it's certainly not right from my perspective.
I've actually seen folks post, and I've heard folks say, well, every virus that's ever happened has developed herd immunity. And I just look at the legion of armchair epidemiologists, and I'm horrified, because none of these folks, despite what they think, have really any idea of what they're talking about. None. It's already accorded that, there was one report out by a Western European Medical Group Society out today that, in fact, that the virus had already mutated to a much stronger, much more virulent format here in the United States. We've seen firsthand how major cities, in particular New York City, have acted as sort of a gigantic atomizer effect. All I could think of is that little bottle you screw into the bottom of your garden hose, if you will, with a little attachment, and you watch yourself spray droplets all over an entire garden, in this case, in an entire section of America. And yet, my main point is that not only do we have a dramatically low level of testing, most of that testing has occurred spaced out over months. So I'm not sure how any of that can be considered relevant. I mean, am I oversimplifying? Do we have to get to the point where we can, within a finite period of time, test a significant part of the community, including those who have been tested already?
Yes, absolutely. I mean, we need to, we're talking about living with a virus that not only is highly contagious, but where the mortality rate is significant because of the transmission rate. In other words, even if we find that more of the population has had COVID-19 than we are aware of, and that leads to a decrease in the mortality rate. In other words, the number of total deaths, the percentage is lower. The fact that it's spreading so quickly also means that it will kill more people. So even though that percentage is lower, it's spreading across a larger population. So when we think of that, and we think of what it means to live with that disease, we need to have, testing done. People in certain professions will be tested multiple times in a month.
Right.
Multiple times in a month in that world, right? In that world where we don't have a vaccine yet. And so where we are today and where we should be, here's my concern with the false narrative that the administration has put forth. There's just one example that I think that embodies kind of everything I want to share with regards to like why I think it's a false narrative that this administration has constructed. The administration said that if there's a business and they discover through track and trace, which their system is pretty, so far, still immature. But if they discover that there's an epicenter growing where, there's a case and there was a small spread of COVID-19 within that business, that within 10 minutes, the DOH and this force would be there in responding, tracking and tracing. They can't even mobilize testing kits. They can't mobilize testing reagents, the solution that's mixed, that the swab mixes in to see whether there's a chemical reaction. They can't mobilize just basic mask. And I'm sorry, but this is a reality. Like these aren't digs. These are basic functions of a health, of a Department of Health in a time of crisis, of a healthcare crisis like a pandemic. These things need to be happening, Pat, and they're not. So it's hard for me to believe when the administration says that they will be at a business door within 10 minutes of discovering that there is an epicenter or spread or resurgence there.
At the risk of sounding ridiculous, who are they going to call? Ghostbusters? There's some rapid response. Have you ever seen the movie Monsters, Inc.? When they discover the invasion of a human being, where they have all those little beings kind of parachute in from the ceiling. What are they talking about? I mean, it sounds like a fantasy.
And again, it's false reassurance. I feel like if it hurts anyone, it hurts the person that's listening, and starts to feel safe, and starts to feel like, that someone's going to be there. And I want everyone to feel safe, but it can't be false reassurance. People
Right.
should know that if the resource isn't there, if the response will not be there, then the public should take measures on their own to protect themselves. But
Right.
if the government is telling them that they can feel safe, that they don't necessarily need to be too concerned, words like that, phrases like that, sentences like that, I mean, it sends mixed messages. It pushes people in the public into dangerous situations. And then when they're in the hospital, when they're in one of these built-out convention center field hospitals, and they can't be with their families, no person in this administration is going to walk to their bed and hold their hand.
Right. No.
And that's the brutal reality of this crisis, right? The people that are making the decisions that will ultimately influence the outcome, which can, in this case, is life or death, they will not go to your bedside and hold your hand.
Nope. Not even one little bit. They won't even have a conversation with a free press right now. So how do we expect them suddenly to, for lack of a better term, to have this deathbed conversion to honesty? And I keep getting back to the fact that they closed essentially that they closed ultimately that they closed summer. All right. They closed summer. And now that's to lead us to a point where we feel comfortable that somehow simultaneously they're going to reopen while keeping everything closed. All right. I mean, I just don't know what to say. It's fraud.
Yeah. In retrospect, I keep hearing people say that, well, this is just shedding light on things that were there. And that's true. It is. Systemic racism has been there. We know the UK released some numbers today that were really interesting. That Black men are 4 times more likely to die from COVID-19 than non-Black men in the UK. And even when they adjusted for age, when they adjusted for underlying conditions, when they adjusted for poverty, when they removed that factor and filtered out what some might consider the actual number, Black men were still 2 times greater, had a 2 times greater risk of dying than non-Black men. And so what does that mean, right? That's the UK, but the numbers in the US have the same trends, right? Reflect the same reality. And the reality is that communities of color have been neglected. That not only are the social determinants of health, employment, housing, right, socioeconomic status, not only do those things contribute to poor health and underlying conditions that predispose them to COVID-19, but that ultimately the way government and the way systems treat those people is inherently different. And so what are we going to do? I don't think that we have 6 months to wait for a federal delegation to want to get elected again or to run for office again, or, and then, decide that they're going to do one or two things to get a vote. We don't have time to wait for an administration that has promised everything. I mean, this administration promised, our immigrant community licenses, never follow through, promised so much to the urban core, never follows through. But now this is life or death. So what are communities going to do today to fight for their lives? Because this is a fight, Pat, for their lives. And however that sounds, however that comes out, it's intentional. The fact is that communities need to stand up today in unison if representatives aren't going to do it for you, and to demand health justice. I mean, health, equity, justice. This is not something that we want to put on a policy and wait 20 years for. I mean, this is something we need today. I at this point, I'm just kind of talking in circles, but the data is there. There's no need to reflect on it anymore. We just need action.
Well, I promised I wouldn't keep you up all night. So let's close with this. Is there anything that you've heard about happening through whatever communication exists between a variety of communities within Rhode Island cities and the administration to suggest that there is going to be any change at any level? Anything?
If I believe that this administration were taking steps to create positive change, programmatic change, infrastructure changes, then there would be no need for me to be on this call with a lot of criticisms. There really would be no need. But the administration has not taken those steps. The rhetoric used is not indicating that they're going to take those steps. The task forces that have been created don't seem to have enough transparency or clear vision as to how they're going to allocate resources. The committees that have been designed around communities of color in order to try to serve as these kind of figureheads for the community have not been given the power to do much. And even within those committees, there have been reports that mayors across different cities have asked this governor to not reopen for the sake of their communities, and this governor has rejected their request. So unfortunately, I do not think this administration will take the necessary steps to protect Rhode Islanders. And again, if we are not protecting our vulnerable communities and those hotspots are growing, then all Rhode Islanders are at risk. We live in a state where we are 2 streets away from the poorest neighborhood, 2 streets away from the wealthiest neighborhood. And until we all really come together in understanding that, we're just going to continue to allow politicians to divide us. So this is an opportunity to come together. This is an opportunity to move forward, to demand health equity, to demand justice as it relates to resources and how they're allocated to our micro entities. And Pat, it really comes down to just the community and individuals like yourself rising up and unifying around that. And I'm certainly going to be here. I'm going to, as much as possible, speak truth to power, at whatever the cost.
Dr. Luis Daniel Munoz joining us tonight on the Coalition. We will be sharing this with the community in a little bit. You'll be able to find this on our website at coalitionradionetwork.com, as well as on Facebook, on Twitter, through Periscope, and on YouTube. We will present this out to the community tonight, and we ask you, if you have a moment, to take a moment to share it. Really for the benefit of folks who don't have access to independent media and who are relying upon, I believe, a limited, flawed interpretation of the current crisis. As a result, that appears to be only what's moving through conventional media. It's time to act. And at the risk of over-dramifying the situation, I don't know that there's a lot of time left. Do we want to find ourselves in a ceaseless, endless cycle of illness, economic destruction? The biggest waste, I believe, in the last 2 to 3 months is that we've engendered all this economic strife and destruction, outright destruction, while at the same time really accomplishing so very little. We may have great press conferences with stoic-looking state officials, but with a cure to this disease so seemingly so far away, how then do they expect, having placed themselves in a position of ultimate responsibility, having precluded the contributions of so many, having left so many people reliant on what is increasingly appearing to be a failed state government, how then do they expect to move forward? What happens when this seemingly endless cycle of infection, reinfection, mutation occurs? And we find ourselves, God forbid, 6, 8 weeks, 10 weeks down the line in the very same place. I welcome your thoughts through thoughtful commentary on Facebook or in social media, or of course you can reach out directly to me at the show, on the show's site, or you can reach out to me by email at pford@coalitionradio.us. That's going to be it for this evening. Again, I want a big thank you to Dr. Muniz for joining us, particularly after a full and rewarding day. We are the Coalition, loud and proud, outrage porn-free, civilly disobedient media, broadcasting live on the worldwide Coalition Radio Network here at the Coalition Radio Network home. Facebook.com/The Coalition Radio, on the mighty, mighty Twitter at Coalition_radio, and of course, our YouTube page. And at this point, we're available seemingly everywhere. Folks, stay safe, be of good cheer, have a wonderful evening, and hug your children. Have a great night.
Have a good night.